Good afternoon. I'm Dr. Ruth Roberts, your host for the Holistic Dog Health Care Summit 2.0, running a little behind, but hey, I'm here and we're here. So, who has watched today's recordings? Because you all were treated to just some amazing stuff. Um, so, our day today was about healing the gut, healing the spleen in traditional Chinese veterinary medicine. And we had Dr. Holly Guns from Animal Biome talking about supporting your dog's vitality and longevity by tending the microbiome. I think everybody knows by now the microbiome has far more influence over our health or lack thereof than almost any other organ in our body. She was followed by Jessica Fisher, one of my certified holistic pet health coaches, discussing using sensitivity testing and rotation and elimination diet to help heal the gut. And then Dr. Betsy Redmond from Innovative Pet Labs spoke about testing, not guessing, so that you can tell the difference between IBD and pancreatic insufficiency. Then Dr. Odette Suter spoke about how microbes could be the key to fighting pet cancer and boosting immunity. That was a really fascinating conversation we had, and she is such a wealth of knowledge. And then rounding out the day was Dr. Susan Burr from CHIPET, speaking about traditional Chinese veterinary medicine digestion, which is like a whole crazy thing. So that was our day, and I think we've already got some questions going on. Buki Mensa, sorry. You're asking about any recommendations for holistic flea repellent spray. So there's a boatload of options. Yesterday, Dr. Megan Barrett spoke about how you can support controlling fleas naturally for your pet. So that if you have the opportunity, go back and take a look at that. And that reminds me to tell you that right now, the All Access VIP Pass is only $59, but at the end of the summit, it will go up to $129. But Buki, I think you'll find what you're looking for in terms of how to support your pet and control fleas naturally there. Let's see. Good deal. And Steph, you're regretting fixing your Weimaraner when he turned 4, when you got a female. And is there a way to supplement testosterone? He also has immune-mediated polyarthritis. I'm very sorry about that, but off all meds, which is a victory. So well done, Steph. And I think we lose the rest of your comment. You're asking about food. So first off, thanks. Proteins in one day. So ideally, there is a site called dogsterone.com. Dr. David Bieber is teaching other veterinarians how to supplement dogs with testosterone, which, because testosterone is a controlled substance, we have to follow very stringent guidelines. What we can do is use testosterone to support pets that have arthritis or the frailty of aging. So if you have not checked this site out, go to dogsterone.com and see if there is a veterinarian in your area that will support you with supplementing with testosterone therapy. And then in terms of feeding multiple proteins in one day, my recommendation has always been to rotate proteins. So you can do this any way you'd like. You can rotate them throughout the day. You can make a batch of food and rotate it once a week, once every 10 days, however often you make food. Or, for some folks, if they had a really big bargain they found on a specific, say, pork butts at Costco, they may feed pork for a month. But what's key is to not get stuck in that same diet day in and day out and day in and day out, because that can end up creating gut-associated lymphoid tissue, activating and acting on what your pet is eating as if it were a food antigen. And indeed it is, if it's improperly digested. And Paula, great to see you. Glad you enjoyed it today. Uria, you are feeding your dog various proteins, yeah, in a day. So again, rotation, rotation, rotation. If one meal is fish and another is chicken, that's perfectly okay. What I would not do is combine two or three proteins in one particular type of food. Um, Teresa, if you have specific issues you're dealing with, that would be awesome. There's a myriad of issues that huskies can get into, but let us know if you have a specific concern you're working with. But what I would tell you in general is if you're not feeding a whole food diet, start. Part of the my free gift for you all is a download of the original Crock Pet Diet ebook, which will give you the basics on how to start cooking for your pet. And then the other things I would suggest are using moderate doses of omega-3 fatty acids if there's no health issues, because that's going to help support inflammation and help control that and prevent damage down the road. And then ultimately, you could look at doing things like a detox protocol. In fact, I just arrived in Dallas today to attend the Cellcore meeting, and the basis of their product line is to help humans detox. And they've got some amazing options for pets coming up. So I'm here to learn more about that today. So all three of those suggestions would be wonderful. The other thing that's critical is keep your baby moving. And promise me, can you all stick your right hand up in the air right now? And promise me that you will shut off your cell phones into airplane mode, take your dogs outside, sit in the grass next to a tree for 3 minutes a day, and just hang out with your dog. Be fully present. And then make your goal to extend that to 5 minutes a day, to 10 minutes a day. And what you are doing by being present, it is a form of meditation. It is a way to calm the mind, and it is a way to move from that sympathetic fight or flight state to the parasympathetic or rest and digest state. And then you can really start getting into some amazing healing. Okay, so YouTube user, 17-year-old dog, just diagnosed with really bad arthritis in her hips. She's been on some omega-3 fatty acids and raw fed his entire life. Also on Glycoflex 3 and acupuncture, and recently bought a PIMF mat. So I think that's amazing. One of the things I would encourage you to consider is that many raw feeders are saying, my dog's not looking quite so good as he gets older. And so what they're finding is that they may need to start gently cooking or even going to full-fledged cooking. And the way you would do that ideally is to first do a Glacier Peaks test to determine what food sensitivities might be present. And you're thinking, Dr. Ruth, have you lost your mind? I told you my dog has arthritis. Well, here's the deal. If the gut is dysbiotic, that creates inflammation. And where the inflammation lands in the body is somewhat random. Sometimes it's predicated on genetics. Sometimes it just depends if there's been an insult somewhere else. So inflammation is behind the cause of pain in the arthritis situation. So anything we can do to reduce inflammation is going to help reduce the pain. One of the other things you could consider would be just arnica tablets. And I think those are fantastic for assisting with reducing pain. So I hope that's helpful for you. Cautious consumer, a supplement recommendation for an 11-year-old female Yorkie with luxating patella. Honestly, it's exercise. The stronger her quadriceps muscles are on the upper leg, on the thigh, the less that patella is going to come out of joint. Now, you do want to make sure that you're supporting your baby just as you would as if she had arthritis, because eventually over time that can happen. But maintaining muscle, feeding a moderate to high level of protein in the diet, and or adding in collagen or whey protein or colostrum in some instances can help your baby build muscle faster using omega-3 fatty acids, using all sorts of things that I just mentioned earlier about supporting your dog's ability to reduce and control inflammation will be critical. So I hope that's helpful for you. Natasha, your mini schnauzer has a blocked nose. He's got allergies, um, but that is worrisome. What does cause a blocked nose? There can be, and you don't mention how old your dog is, but sadly, there can be cancer. We have seen nasal carcinomas in dogs. The other thing would be polyps, which are much more benign, of course. And then if there is some sort of a really overwhelming infection, often a fungal infection, that can create it as well. So what you might try is warm compresses, and you may have done much of this already, either castor oil packs or warm compresses and Epsom salts, making sure we're keeping that away from the eyes, and then using drops of colloidal silver down the nose to see if we can loosen some things up. So hope, and then the other thing too is if you feel like it's due to allergies, this is where quercetin and stinging nettles can be extremely helpful. So we've got a product called Histopause on my website that's been used by many, many pet parents to help get their pups off of Hapaquel and Cytopoint and all those terrible things. So check that out. Marilou, what is the best type of bone for a medium-sized dog to chew on and not choke on? So that is the critical thing, right? Making sure we're not allowing this dog to choke on the bone. So what I would say is get one that's fairly large. So maybe a tibia would be too big, but maybe a piece of shank this big. And what I would do is if she's not accustomed to chewing on bones, keep a close eye on her the first few times she's doing that and make sure she's not trying to just consume it all. We have seen older dogs, as they start to chew bones, crack teeth. So we want to limit the amount of time she's doing this to maybe 3 to 5 minutes a day, so that we don't overstress the teeth or the jaw. But great option. I think they're incredible stress relievers. You can buy these all over the place. You can go into, if you've got a local butcher that has organic or pasture raised beef, that would be an amazing source. And then any of the local stores. Jessica, that is awesome to hear. You're looking for a holistic vet. If you are having trouble finding one, this is where holistic pet health coaches can really help you. So if you head over to my site at drruthroberts.com and click Find a Coach, you will get connected with 53 of our graduates that are just doing amazing things supporting pet parents. So check that out. Natasha, she's almost, so your doggy, okay, with the blocked nose, almost 4. That's kind of weird. And I'm assuming you may or may not have been to a veterinarian to get this checked out. But if you think the nose is blocked, that honestly, that would be the first step, is to see, what's going on in there. And I know it's tough getting in right now. Let's see, the innovative ecoist. Your dogs, one gets sick and then the other one as well, and then vice versa. And you get it checked and treated. Okay, so what kind of sickness? Are they having diarrhea, vomiting, sneezing, respiratory stuff? It's kind of hard to know how to support without a few more specifics. Cautious consumer. The reason I don't recommend mixing proteins in a meal is, and they do indeed add fish for the omega-3 fatty acids. So you kind of got to sort through things. So the best I can tell you is, if your dog has ever had GI problems, it is better to keep the proteins separate, because there's less likelihood to develop sensitivities to what the dog is eating. So if we've had this happen with salmon oil, for instance. That was one of the most commonly used omega-3 fatty acids sources. And I would say that 50% or more of the dogs that we send out the Volusia Peaks test on, we're seeing come up reactive to salmon. And indeed, when we take salmon, either the fish flesh or the oil out of the diet, the symptoms get better. So and then in terms of hydrating, plain old water works well too, or you could just use a stock rather than a bone broth as well. It would be, again, ideally better to keep sort of today's pork day, today's beef day, today's fish day, just to help keep things a little cleaner. 11-year-old Kai Chicks, 11-year-old boxer with acid reflux and sometimes BBS in the morning. And you're feeding 3 to 4 small meals with one at bedtime plus Pepsid. So we talked a lot about this today in terms of gut health, and actually in days past. What often is going on is the acid production timing is not good with when the food is in the belly. So you can add things like, for instance, apple cider vinegar to help increase the acid content to assist in digesting the food. And then the other thing would be getting a look at what's going on with your dog's microbiome and or if there's food sensitivity. So again, I hate to keep saying the same thing over and over again, but this is where it's truly important. If your dog has food sensitivities, that could be causing the gastric reflux. So I think that's where you need to really look at what your dog is eating. If your dog's eating kibble, then that carries a lot of energetic heat. That can create a lot of problems. But there's one supplement we've used over the years called Heartworm TX that has things that will help sort of soothe the acid production that's a little delayed, as well as prevent that reflux. So that's another one you could look into. And Natasha, you are welcome. Can CBD and Jennifer's asking, can CBD with salmon oil have an effect of clearing hazy eyes? And your Morkie has gotten better vision since starting CBD. Amazing. And that makes some sense. So if the surface part of the eye, the cornea, was cloudy, that's a reason, that's inflammation and edema. So you've started really 2 profound anti-inflammatory products, both CBD and salmon oil as an omega-3 fatty acid supplement, and that can indeed reduce the inflammation in the eye, and you can improve clarity. Also, if there were fat deposits, that helps to move those fat deposits from the corneas back into circulation. So wonderful news, Jennifer. Great. Jessica, you've got a female beagle with seizures. She's 5 years old, and they started at about a year of age and currently controlled with zonisamide. So this is where there's a couple of approaches here. Again, Jessica, I think this is where you really need somebody in your corner helping you walk through this. But keto diet has been very helpful. Going to a low carb, high fat diet has been extremely helpful for many dogs with seizures. If your dog has ever had pancreatitis, that's not going to be appropriate because the fat will create problems with potentially creating that pancreatitis coming back in. If you are not using a CBD product, please, please, please get one. The one that I like the best is CBD Dog Health, which has been designed by Angela Ardolino. I like their Heal product and also their Ease product if there's any type of arthritis, discomfort, things like that. And what I would do is start somewhere around 2 milligrams twice a day, titrate up to maybe 9, maybe up to 20 milligrams twice a day. And then the other thing that's been helpful is Microdog Clarity, also designed by Angela Ardolino to help improve brain function. And so with those 2 products and with the support of your veterinarian and your holistic pet health coach, you may find that you're able to titrate that medication dose down and get your dog off of the zonisamide. Now, I would do this with great caution, and again, make sure that everything else, gut function, inflammation, detoxification, is perfectly working, because we want this to be a super easy transition. And remember that if you have put any dog on anti-seizure medication, if you stop it abruptly, you can cause that dog to seizure. So this is a very slow, cautious process. And if dogsterone doesn't have any vets in your area, um, I cannot prescribe it, but what I would do is talk to your veterinarian, send them the site, send them the information that Dr. Bieber has prepared, and see if they're willing to work with you on that. The other thing you can speak with them about too is supralorin implants. This is a gonadotropin releasing hormone inhibitor that has been approved for use in dogs and cats all over the world, but not in the US. In the United States, it is approved only for ferrets. And the reason would be helpful is that it shuts off GnRH production, which, as you may or may not remember, is what causes high levels of luteinizing hormone production. So this could be very helpful in supporting your pet to reverse that autoimmune disease, the polyarthritis. Azucena, when you're talking about raw, I've seen it help senior pit bull with arthritis and senior chihuahua skin. And so the reason one of the videos said maybe raw isn't okay for seniors is as we age, our digestion declines. So for many senior dogs, they're doing okay, but maybe not fantastic. And so when many people try either gently cooking the raw that they've got or start cooking, they start to see those dogs look even better. And the reason is that it's easier to get the nutrients out of food that's already been cooked because it is essentially pre-digested. So if you listen to Dr. Susan Bohr's talk today in terms of TCBM, traditional Chinese veterinary medicine, we're taught the spleen abhors cold and damp. Well, if you're feeding raw food, it's cold and it's damp, it's engendering. So by taking those things out of the system, when we don't have as much fire as we used to when we were younger, we can start to see these senior pets really look better. Let's see. So the innovative equist, one of your dogs has a deep pyoderma and mammary gland tumors, and she's been on steroids and antibiotics and fed a home cooked diet, but it's difficult for you to get meat. And I understand that. So I'm not sure where you live. And then your follow-up question about mammary tumors. The problem is that if she is still intact, that does tend to make the mammary tumors become to grow faster. And every time she would go and heat, then you may see those tumors pop up a little further. So it's the interesting thing about mammary tumors is that 50% are benign. Of the 50% that are malignant, 25% stay put, 25% have the potential to metastasize. Now, because we don't know which of those are going to do what, this is often why veterinarians will recommend removing them. One of the other approaches you could consider would be to use topical products like Remedy, which was designed to help break up tumors. Now, the deal is you got to be prepared for that because they will break open and then kind of look yucky. But if one of your dogs has a deep pyoderma, there's some healing in the gut that needs to happen. And what you may see as that occurs is not only does the skin get better, but maybe these mammary tumors start to shrink down a little bit. Carol's in the UK. Any sensitive companies or holistic vets? You got a Greek rescue and develop anaplasma, which not as fun. So Carol, the Glacier Peaks test I've been mentioning does ship internationally. And in fact, I believe you can go to our website, ask my folks for support. They can help you arrange that. We have a student health coach in the UK, although she's not completed her training as yet. And again, if you're dealing with IBS and Sibo, this definitely is a pain in the behind. So that's where you're going to need to feed an extremely low carbohydrate diet if you're cooking it, and basically a keto type diet. I've had Sibo. I'm here to tell you it is extremely unpleasant. And what happens is if the bacterial counts are super high in the small intestine and you eat any sort of carbohydrates, it feeds those bacteria so that the counts go higher, produce lots of gas, lots of bloating, lots of discomfort. And the way to really work on this is to start by removing carbs out of the diet. So that would be a first step. Again, go to, I think somewhere in here there is a download link for the original Crock-Pot Diet ebook, which was part of, if you bought the Summit package, I think you get all of those right off the rip. Right on. Let's see. So I hope that is helpful. And Jennifer, you are welcome. You're not crazy. I'm glad you're enjoying the tests at the end of the webinars. That means you're really checking out the information and putting it in here. Let's see. Great, Jennifer, good. So you got some, yeah. And then innovative ecoist, should you operate the mammary tumors again? I think partly I explained this in terms of you may get some benefit with topical treatments, but spaying will be the one way to make sure that we really slow down the growth of the tumors and new tumors from developing as well. So I think what your veterinarian does make sense, and almost a lifetime of pyoderma. That's awful. I'm so sorry to hear that. And I am not sure where you are, but again, if you're in the US, AHVMA is a good source. And then again, on my website, Holistic Pet Health Coaches, that can help you work with your local veterinarian. All right, good. Good. All right, Jessica, good. Glad I can help you. Azucena, would cooking the meat burn off the nutrients of the food versus raw? And if so, is this where supplements come in? So this is the big debate, right? Yes, if you have a piece of raw meat, there's 100% of the nutrients in that piece of raw meat. Now, how well can your dog digest it? Let's say it's able to digest it in the raw state, maybe 20%. So that means from that 100% of nutrients, 20% of the nutrients are actually what your dog can absorb. And that's just a ballpark. So, that may vary. The concept is with cooked food, if we cook them, perhaps we're going to decrease the nutrients in that same piece of meat from 100% to 50%. But what if we've now improved the digestibility to 70%? Now, from that 50%, your dog is able to absorb 70% of that. So now essentially your dog is able to absorb 40% of the nutrients in the cooked meat versus maybe 20% in the raw meat. Does that make sense? So cooking is part of what helped us develop our big brains, if we would only use them, right? And really take us strides beyond our ancestors. And because dogs evolved with us, they were eating our leftovers, our garbage first, our poop as well, and then our leftovers, and then what we fed them finally. But that's kind of my point. There's the big raging debate that raw is the only way in the ancestral diet of dogs, but I would urge you to consider a different perspective. So I hope that makes sense. Topical products. So, for instance, you can use bloodroot, you can use remedy topically, again, made by CBD Dog Health. It's an amazing salve that you can use. People have used castor oil packs. I mean, there's a myriad of options. And again, if you're trying to figure this out, the best way to do this is to work with somebody that can help you shortcut all the searching and figuring things out. Kathleen, you have to choose between topical steroids and strong antibiotics or oral antibiotics. I mean, I would choose topical, hands down, every time. The deal is you want to put the topicals on, cover it so that your dog can't ingest it, and or then immediately go for a walk, so that by the time you come back, the dog is not so focused on cleaning that off. And then again, there's lots and lots and lots of options for skin infections. For instance, again, remedy, castor oil, Epsom salt soaks, which if you're looking at steroids and antibiotics, you may be past that by now. Let's see, YouTube user, your dog has a lot of hair in the ears and the wax accumulated and it causes a liquid sound. Okay, so there's a couple of things that can be going on. If you've done food allergy and animal biome testing and you've eliminated all of the things that could be creating an issue, the other thing to consider is the most common cause of a chronic ear infection is that the first one was never resolved completely. And what can happen is if there was a really bad infection, the middle ear may be open, the tympanic membrane or eardrum may have ruptured. And so if that gunk gets stuck under that middle ear tympanic membrane, then it can rupture back open, or that eardrum may never seal properly. So what I would do is speak with your vet and see, get them to take a good look. And if needed, if they can't see the eardrum, it may be that flushing the ear out under anesthesia actually helps to resolve things, because finally, if that eardrum is open, that middle ear gets flushed out with saline and becomes clean. So I hope that's helpful. This is where, again, too, CBD can be helpful because it does help to bring the system back into homeostasis. You could use, again, CBD Dog Health Heal. You can put a few drops in the ear. You can, and then certainly give it orally as well. And Innovative Ecoist, your other dog gets random stuff like skin issues, chronic lethargy, and I got no idea. So this is like, and here's what I want you to understand. If you've got dogs that have had health problems for over 2 years, this is where you really need somebody on your side to walk through this with you. But again, the basics are going to be food sensitivities, microbiome, the ability to detoxify, the ability to control inflammation. And so those are all places you can start. But if you're still making, having a great deal of issues, then this is really where you need somebody on your team to help you with this. Deborah, you've got an 11-year-old with suspected protein-losing enteropathy. Any Chinese herbs to help with this? Yes. So again, this is where you want to dial in the diet. You want to understand what's going on with the microbiome. There's a very famous Chinese herbal called Xinling Baizu for diarrhea. And then because anything strange is phlegm, this is where a Pinellia type formula may be helpful. So I would check those out. And again, protein-losing enteropathy is really a difficult thing to deal with. I know that Animal Biome has had some success supporting these dogs with fecal transplant, but again, you need to go super duper slow. And this is where, again, a health coach can help you. In rescue, as I was saying, you've seen a large number of small dogs come in with heart murmurs. And what supplements or herbs should we consider adding to their diets? So one thing like Hayo is the only poodle I know that does not have a heart murmur. So we grade heart murmurs on a scale of 1 to 6, 1 being the least severe, 6 being the most severe. Many small breed dogs have a heart murmur that's audible at a stage 1 or a stage 2. And if there's no problems health wise, often we will call them innocent murmurs, meaning they're there, but they're not creating problems. Now, if you're running a rescue group, what I would suggest you do is really focus on healthy food, using probiotics or something to help rebuild the microbiome, and uh, and then see where you can go from there. So a higher protein diet with lots of taurine, carnitine, CoQ10 could be another supplement. But I suspect that many of these guys, once you get them sort of with their feet back on the ground, that the murmur may sound better a little bit later. Also, if they're stressed out, that murmur sounds much worse. Kathleen, you're asking about augmentin clavamox. Um, if if the culture and sensitivity is showing positive for this antibiotic, you can certainly use it. If you've used antibiotics and it comes back, used antibiotic and it comes back, then I'd encourage you to take a different approach. Now, if your dog is absolutely miserable and this is the way that you can get her comfortable again, by all means do it. But start a megaspore, probiotic, or phytospore prior to the antibiotics to help protect the microbiome. And again, this is where you're going to need to do some deep work to heal the microbiome in order to make the interdigital cysts and infection go away. I hope that helps. I wish I had quick and easy answers for you, but otherwise I think you guys wouldn't be here because you've already done the quick and easy stuff and it's not getting you the results you want. Cool. So Carol, good. If you've downloaded the cookbook, then you can look at food sensitivity tests and create your own recipes and feed them every 72 hours, just as Jessica discussed in the rotation and elimination diet section. Uria, a low-fat diet for life is not a good idea, right? We've been in this thing where low-fat's supposed to be good. It turns out that if we don't eat enough fat, our brains don't do very well. And so it's amazing for people that have Parkinson's disease, if they increase their fat intake, their symptoms go down. So, but your baby has difficulty digesting fat. And so this is where you want to start working on. And I'm sounding like a broken record, and I really apologize, but it's true. So supporting the gut, healing the microbiome, and then if you are using something like a bile salt or a bitters before you eat, before the dog eats, this actually, which can be a little bit of a tough sell to dogs, but bitters actually help the bile empty into the GI tract where it's able to support digestion of fat. Digestive enzymes can be helpful, especially lipase. That's the one that digests fat. And then you may be able to gradually titrate your way up on the fat level. But what we see is that dogs that stay at chronic low-fat diets end up with really dry skin. They end up with really dry hair. They don't feel as well as they should. And we see their cognitive function decline. And often we will see more behavioral changes as well. So Santa, I'm glad that that my answers are making some sense for you. And then innovative ecoist. Yeah, hyaluronic acid, chondroitin sulfate, glucosamine, omega-3 fatty acids. I mean, there's a laundry list. So that will help. And if you're seeing intermittent limping, that means that something's not going right in there. And so any attention you fix on reducing inflammation will end up benefiting the health of your pet later. Carol's done biome testing and it has parts missing, but everything else is out. So this is where the fecal transplant capsules can be super helpful. And again, you have to feed the dog to have those parts of the microbiome come back in. So if we're feeding a raw keto diet, it may be extremely difficult to get the microbiome to become more diverse versus if you feed healthy carbohydrates, plants, vegetables, um, that's going to encourage the microbiome to become more diverse, more rich. And then you can use things like simple starches like sweet potatoes in small quantities to again look at the ability to expand the microbiome. It is a frustrating and it's a long process. Um, yeah, for Cushing's, it's very, very interesting in terms of what's going on. So it turns out to be like an estrogen dominance. Here we are with another hormone imbalance. But if you can work on supporting liver detoxification and improving gut health, a lot of times we can take these dogs that are early in the course of Cushing's disease, along with lignans and melatonin, and really reduce the symptoms and in some cases get this into remission. So I think a lot of these chronic adrenal diseases, partly it's because the liver is not able to clear excess levels of hormones. Um, yeah, if you innovative ecoist, if you don't have access to a holistic vet, again, holistic pet health coaches, they are not veterinarians, but they have the tools and the ability to walk you through the steps that you need to take to get your dog returned to health. Let's see, where else? What am I missing, Jindy? Jindy's in the background helping me, keeping me on track. Um, yeah, food sensitivity test is 129 bucks. And it is some money, but it's not $400. That's kind of the deal, right? Um, yeah, Nordic Naturals Omegas. So look at the source of this oil. I think this is probably an anchovy and sardine source. And so you have a couple of alternatives. One is calamari oil, which you can get from standard process. And then the other is an algae-based omega-3 fatty acid. So again, this is an important thing to rotate. Like we tend to go on autopilot sometimes, right? But I have to remember myself, we have to rotate the omega-3 fatty acids we're taking as well, and for HIO, because we don't want to create this situation where we have food sensitivities. So Kathy is asking about UC2 collagen, um, which is a specific derivative, and it does have pretty marked uh, results in terms of improving inflammation even more than glucosamine. And I think that it's an option. You can also just use any type 2 collagen is really the one that's designed more for the joints. I prefer to try to take things, if we can, in whole foods. So, because there are other benefits to that. And chondroitin, it turns out, actually may be a better option than glucosamine. And again, you can rotate. Like sometimes we'll pick a kitchen sink joint supplement, for lack of a better descriptor, and use that for a long time, and then it may not work so well. So I think that you need to find the least number of inputs that do the most work for you. I hope that helps, Kathy. Kai Chicks is asking if food sensitivity changes over the life of the dog. Absolutely. If you did a sensitivity test in 17 and checked it a year later, it would have changed. So if you're hitting issues that are not working well, then I would definitely redo a test. And then sometimes we will repeat tests in 6 months because it's like we're peeling back that layer of an onion. And then we peel back, okay, the sensitivities to this, to that, the other, and then we can incorporate some more foods by retesting in the diet, but sometimes it doesn't work. So I think it's a good idea to repeat that test once every year, or if you're seeing GI problems crop back up and you've had that issue in the past. Kathy Watzek, your dog is on gabapentin and carprofen for cranial cruciate tears. So first of all, she's on that for pain, right? So, and I'm not sure where your pup is in terms of the healing process. I would suggest using, if the legs still really bother him or her, I would recommend, sorry, it is a her, using braces, because that will help support the knees without putting more stress on those tendons. And then what I would do is find some other things that you know are going to support healing those joints as well as controlling the pain. So number one choice, CBD Ease, again by CBD Dog Health. Number two, omega-3 fatty acids. And then number three, there's several Chinese herbals like frankincense relieve soreness, invigorate the collaterals. Those are similar. They include frankincense and turmeric, which is also what's in CBD Ease. And then what I would suggest is that you start by titrating down the carprofen, because it's going to have more impact on the liver. And then probably ought to consider a little milk thistle as well to help support the liver if you've not been using that. And then see if you can titrate down the gabapentin. So boom, just go slow, 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 little bits at a time, so that your dog stays comfortable and is well supported. I hope that's helpful. Uria, the bitter, so Wise Woman Herbals makes a product called Bittersweet that I've used personally and for my patients for years. It has a little bit of honey in it, so it tends to make that taste quite a bit better. So I hope that's helpful. YouTube user, you've got a dog that's had a bad tooth infection, which was extracted, and every time he pants, he starts pawing in his mouth. If the surgery was relatively recent, I'm wondering if there's something that's impinging. So when he opens his mouth, something gets pulled. So if you really, I would recommend talking to your vet, getting a good exam in there and seeing what's going on. But that's kind of weird. So generally, if there is something going on in the mouth, it's uncomfortable when your dog opens its mouth. You need to look at the jaw joints, and then if there is something physically impinging. And Kathy, well done, getting her off of GABA and carprofen. And then detoxing, that's kind of the other part I missed, sorry. Then the other thing I would look at would be fulvic acid, humic acid, so carboxybicell. If you all are familiar with Polypet, it's a similar product. It was an offset of Cellcore. Unfortunately, they are out of stuff, and so they'll be shutting down relatively soon. But you can reach out to my coaches. They can get you connected with some of these very amazing detox products. Innovative Ecoist for the mushrooms. If for allergies, skin issues, all of those things, hands down, Vitality tincture by Microdog has been one of the best ones for general immune support. Okay. And then Carol, if they cannot send fecal transplant capsules to the UK, I'm not sure how to help you, to be fair. I think there's a couple of others around the US, but it's because it's live animal material, customs people tend to get a little crazy about it. Okay, so Kathy, I got you covered. So definitely carboxy, lots of water, support the liver. Milk thistle is often sufficient. You could also use liposomal glutathione, which is the master antioxidant for the liver, to help improve that as well. Cool. All right, now that I'm to the bottom of the list, I want to tell you a couple of more things. Tomorrow is our last day, and on day 4, we are completing this with a really amazing lineup of speakers. So my goal was to give you things that you can do at home for physical care. So starting the day off will be Dr. Igor Yerman from PetsPimp talking about pulsed electromagnetic field and using that as a therapy. So this is a way to discover, we had a very long discussion about the science behind the ancient concept of electromagnetic healing, and why PIMP therapy is considered a non-invasive spa day for your pet's cells. It really is an amazing technique. And then learning how to seamlessly integrate PIMP therapy into your dog's daily routine, along with any other support you're giving. Dr. Yerman is quite brilliant. He is from Slovenia, the land of Nikolai Tesla, and his research has been just amazing. Next up will be Donna Woods speaking about using light therapy to heal chronic disease. For those of you that are not familiar with red light therapy and the other colors, Donna's going to break down how green and blue light therapy could be the secret weapon for calming anxious pets and combating bacterial infections. So I can't remember who it was that was talking about her chronic pododermatitis, but that might be a real amazing tool for you. And you'll learn both the science and the history behind red light therapy for pets. And she was going to tell you a few of her major wins that she's been able to help pet parents bringing their pets back from really grave illness thanks to light therapy. Following Donna will be Michael Daly, another one of our certified holistic pet health coaches, also a canine massage therapist, and he's going to show you some simple massage techniques you can use at home. And it's amazing because when we start doing these massage techniques, there's a whole bonding experience that goes on. So remember earlier when I asked you to stick your right hand up and promise you'd shut your phone off? If you start doing these massage techniques, put the phone into airplane mode and just be there with your dog. Your dog's going to be like, oh yeah, finally, she's chilling with me. This is awesome. And then he'll also discuss how to incorporate range of motion exercises into your dog's routine and why they're vital, and how to transform your living room into a wellness retreat for your dog with simple massage techniques. So finally, Dr. Jeff Feynman is going to finish up the day for us, and he's going to be speaking about veterinary spirituality, or pet spirituality really, and symptoms for healthy animals. Dr. Feynman's training is homeopathy, but he's understood that this energetic medicine is just one of many tools, and really what his goal is to help you understand how you can connect to your dog on a spiritual level and really nurture that bond and be able to receive what it is your dog's trying to tell you, mirror back to you in many cases, as well as advance your relationship and deepen your relationship with your dog. Now, it is your last chance to sign up for the Lifetime Holistic Dog Summit 2.0 access. And again, today, $59. At the end of the day tomorrow, it goes up to $129. So this is a great investment. It will provide you information for many years to come. And lastly, I would be remiss if I did not thank our sponsors. So Chi-Dog, which makes amazing home-cooked food based on traditional Chinese veterinary medicine principles for specific patterns of disharmony. And Dr. Borer made it easy in terms of, if your dog's doing this, then feed this. Animal Biome has been a great sponsor. Again, they're the pioneers in microbiome testing for dogs and cats, and they were one of the first to market with amazing fecal transplant products. PetsPimp, as I mentioned earlier, very, very innovative company, again, based in Slovenia. They have a pad for pulsed electromagnetic field therapy that is very inexpensive, 25 times more powerful than many of its competitors, and extremely lightweight and easy. You control the mat with your phone, with an app on your phone. There are several presets that are just simple to use, and then you can also go get support from their Facebook group. And if your pet's dealing with a specific issue, then they can give you the advice for a very targeted frequency and time and hertz and all of that stuff, which you can set in your custom programs. And then lastly, we want to thank Dr. Rob Silver with Well Pet Dispensary. Doc Rob has been in the veterinary world for longer than I have, and he's done a lifetime of work. Cool. So I think we got a few minutes for a couple of more questions. Great. I'm glad y'all are getting that premium pass. I think you're going to be really pleased with it. And as Jennifer said, there's access to so many more resources and webinars. It's just good stuff. So Steph is asking about organic free-range eggs. Organic and free-range, yeah, obviously the best. Ground meat, veggies, fruit, et cetera, et cetera. But if you're finding the prices are too high, I get it. I mean, food prices right now are just hideous, right? So, Steph, what I would advise you to do is look for the leanest cuts, because in the conventionally produced animals, the majority of the stuff we don't want to feed to our animals, to our dogs and cats, is in the fat. So if you get lean cuts like London broil, top round, pork tenderloin, interestingly, is leaner than boneless, skinless chicken breast. By removing the fat, you remove the majority of the fat-soluble toxins, the mycotoxins, the antibiotics, the hormones, all of the garbage these animals have been fed in their lives. So that's a good way to keep it as clean as possible. Innovative Ecoist, yes, you can do ozone therapy, and it's similar precepts. So there's a company called O3 Vets that can work with you and your veterinarian, and they have been able to support pet parents who don't have access to a veterinarian that can support them. And they've got an online course to help walk you through how you might do that to support your dog. So I think that is the questions. Did I miss anything, Jenny? We covered? If not, we will see you tomorrow, same bat time, same bat channel at this link. I think you're getting emails every day with reminders about when the summit starts. Come check back this group, same 6 p.m. Eastern time. And I'll be here for one more round of questions and answers for you. The other thing I almost forgot, for those of you that have struggled with kidney disease, or if you have a pet that has kidney disease, boom, thank you, Hina girl in Maui, your 17-year-old Pekingese. This is for you. I am doing a 2-day workshop to help you support your pet holistically with kidney disease. The cool thing is that I'll go through and teach you what stage 2 means, what that means, what you need to do, what your average veterinarian will advise you to do, and then all of the options you can take. In this workshop, it's live one-to-one on Zoom. I want you to bring your lab reports with you, because I can help you figure out what's going on. So exactly. So Hina girl, Maui, stage 2 chronic kidney disease, probiotic, milk thistle, brain supplement, joint treat, spread out. But which meat and protein is best? And truly, I think the best way to answer that, because again, kidney disease underlying it is inflammation, is again, we got to go back to the gut, fix the gut. So food sensitivity testing, and then feeding appropriate proteins and other foods for the dog. And Deborah, how do you sign up for the kidney class? Jenny, if you can flash that link one more time. These links are going to be at the top of all of the comments from today, but this is it. The Go Pets Summit, Pet Summits courses, Healing Dogs Holistically. Healing dog's kidney holistically. So I think you will enjoy that. Got a few tricks up our sleeves. All right. I think I've got all the bases covered. Let me make sure I'm good. All right, cool. We're good. So we will see you tomorrow. Thank you for showing up. I really enjoyed getting to know a little bit about you and your pets. See you tomorrow for our last round of question and answer.